This is a story we've been following since October. Months ago, Louisville Mayor Greg Fisher announcing a pilot program to divert some 911 calls away from police and into the hands of mental health professionals. Now the mayor's office says the new project aims to start in just a few days.
Through a $1.7 million contract with 7 county services, the goal is to provide social and mental services to people in need. Tonight, Isaiah Kim Martinez tells us what the community will receive those services first.
The mayor's office says the goal is starting Monday. These calls will give more options over the phone, specifically for those in mental health crisis. A pilot program announced 5 months ago.
Our mentally ill people, how can we help them?
Based on a model seeing results in other states.
Obviously want it to be successful here as well.
Will officially start in Metro Louisville within just days. The mayor's office telling us the 911 Deflection program is staffed and ready to go. Metro Council President David James, a former police officer, is hopeful.
There will probably be some bumps along the road as we work out the kinks, but I think freeing up our police officers to deal with gun violence and things like that, and actually using a mental health specialist to deal with people with mental health issues is going to be good for our city.
The program will start here in LMPD's 4th Division, South Louisville. Potentially as early as next week, people dialing 911 from the area will have more choices. MetroSafe will decide whether to transfer the call to crisis triage workers, newly hired by city partner 7 County Services. If they determine non-police intervention is needed, they'll send a new mobile response team on the field, meet the person face-to-face, de-escalate, and even transport them to a care center if needed.
We'll probably have to work out how many people do we actually need to do it based upon calls for service.
The project will start with 1 shift, 7 days a week, with room to expand. 7 County Services has hired 11 workers on the team for now, including 2 case managers.
It cannot be seen as an extension of LMPD, and to be transparent with the community that you're trying to serve is going to be extremely important.
Therapist and CEO of Begin to Talk LLC, Alicia Durrett-Johnson, says trust will be everything and connecting further with other existing centers. She also says space is running thin and there needs to be more created.
To increasing those community resources as well.
The full Metro Council will vote this week on funding consultants over at U of L to review this program as it develops. The mayor's office says that first report is expected within the first 2 to 3 months of operation. In Louisville, Isaiah Kim Martinez, WHAS 11 on your side.